Hello, this is Dr. Ernesto Medina, founder of the Bay Area Health and Wellness Center in San Jose, California, presenting another case study for you guys, this one on thyroid dysfunction, rosacea, and fatigue. Quick disclaimer, this information is not intended to treat or diagnose any condition. This case is provided by the Bay Area Health and Wellness Center for informative purposes only and is not intended to replace the medical advice of your doctor or healthcare provider. Please consult the advice of your healthcare provider for any medical concerns. Every case is unique and different, and the interventions outlined in this presentation will not work for everyone. Alright, so we have a 36-year-old female, chief complaints of rosacea, inability to lose weight, and constant fatigue. So this woman is an avid CrossFitter, working out 5 to 6 days a week. She eats a very well-balanced diet, consisting of macronutrient counting by a nutritional advisor designed for performance and her weight loss goals. But she had experienced no major improvement in months despite following the strict program. She consistently slept about 7 to 8 hours a night, but always woke up feeling tired. She had no more PRs in her workouts or personal records in her workouts or Olympic lifts for quite a while, and she had been on oral birth control use for the last 3 years and oral antibiotics for the last 2 years for her rosacea and skin issues. So we ran a thorough blood test on her, and what we found were elevated inflammatory markers of CRP and homocysteine. She has poor thyroid uptake and conversion affecting her metabolism. She had functionally high liver enzymes, indicating inadequate liver detoxification and clearance. Her vitamin D levels were below optimal ranges, and she had many micronutrient deficiencies, indicating poor intestinal absorption. These are the results of her thyroid panel on her blood test, and you can see here we ran a very thorough thyroid panel consisting of 8 different markers plus 2 antibody markers. Anybody who's had their thyroid tested by their medical doctor knows that typically the only things that are tested are TSH and, if you're lucky, T4. But in order to have a thorough thyroid evaluation of its function, you always have to check these 8 markers. And what we found on her was very interesting. Her TSH would be considered normal by medical standards, but when we looked at the other markers, her T3 uptake was significantly low. And now this is indicative of possibly an estrogen dominance affecting poor thyroid binding to the cells in her body, which was adding to her slow metabolism and thyroid function. But her reverse T3, you can see here, was also very elevated, which means she was having poor conversion of those thyroid hormones. The therapeutic interventions we used, so the patient decided prior to starting the program that she wanted to stop her birth control and rosacea medications after consulting her medical doctors, of course, to experience the full effects of the nutritional program. We put her through a 5-week liver detox and intestinal repair program. We had her detox off caffeine to help adrenal gland function and sleep quality, because she had gotten to the point where she was relying on coffee and caffeine to keep her going every day. We coupled that with an adrenal gland adaptogen supplement to help her adrenal glands just kind of keep working as well as they should be. And we put her through an elimination diet during those 5 weeks to identify any inflammatory foods that could have been contributing to her inflammation and her skin issues. So after 5 weeks, her rosacea and facial swelling improved without continued use of her meds. She consistently woke up feeling rested without the need for caffeine to get her day started, and she was sleeping the same amount of hours. She was just getting better quality sleep. Her thyroid markers completely normalized. Her micronutrient deficiencies improved to optimal ranges, and she lost a total of 14 pounds, 12 pounds of body fat, and only 2 pounds of lean muscle tissue. So you can see here, this is her updated thyroid panel. And this was the before and after side by side, and you can see in the new one that we did only 5 weeks later, almost all of the numbers that were in red are now in optimal ranges except for one. But even the one, the T3 uptake, it's still greatly improved from what it was from 23 to 27. This is her DEXA scan results. So back in April, the patient had had a DEXA scan to kind of calculate her total body fat percentage and fat tissue to lean muscle tissue ratio. And you can see the difference here. At the end of the 5th week, she did a new DEXA scan, and you can see the drastic improvements. Her total body fat percentage went from 27.2 to 21.4. Her total mass or weight went from 162.9 to 148.7. Her fat tissue in pounds went from 44.3 to 31.9. And her lean tissue mass went from 113 to 111. So again, my name is Dr. Ernesto Medina, founder of the Bay Area Health and Wellness Center in San Jose, California. We offer free 30-minute consultations to anyone wanting more information. You can check out our website, www.bayareahealthandwellness.com. You can follow us on Facebook at Bay Area Health and Wellness, or you can call our office to schedule your free consultation at 408-755-5710. Thank you very much.